When the viewers are sitting here watching you speak and knowing what you do, the obvious question for a viewer is, how believable are you to your patient when you look the way you look versus how they are when they come in? How do you convince them that this is...
I generally don't have to convince them. I hear that from patients all the time. In fact, a patient told me once that when I was going to give a lecture, which I give a lot of lectures to patients, educational lectures, to really get the word out there and to educate them about the surgery and the risks of being obese. When one woman saw me walk up the aisle to give the lecture, she told me later that she thought to herself, what does this woman know about being overweight?
So what's the answer?
Well, the answer is, I haven't struggled with it personally, but my entire family is devastated by obesity. My mother and I are virtually the only ones in my family who haven't been stricken with this disease, and I lost all my grandparents early on due to obesity, and virtually everyone in my family is looking at an early death because of obesity. So it's very near and dear to my heart.
So this is a very similar story to a physician getting into cancer research or heart disease because their families have gone through that.
That's right.
So once you tell them that, obviously they get a little more familiarity with the believability quotient. It kind of raises a little bit. What's the long-term procedure for them? Once it's over and you release them and they have their medication, not medication, but their vitamins and supplements and things. Did they come back for periodic checkups or?
It's long-term, lifetime follow-up with me.
Ah, okay. So they have regular.
Absolutely. A lot of my patients come from all over the country, different countries, all over the world. Now we have a very sophisticated set of consumers. So my office is very good at setting up routine monthly telephone follow-up. So I follow up with the patient by telephone and work through their family physician to get any additional tests done or blood tests, that sort of thing is done periodically. So I visit with my patients at least every month for the first year and then every 6 months to a year thereafter.
And that's good for expense containment. If they're in Iowa or Nebraska, they don't have to fly to San Diego or vice versa. You don't have to go there. Now, I noticed in the piece that I was reading, over 5,000 people have gone through this program at Alvarado already. So I guess we're safe in saying that you're kind of a cutting-edge, trend-setting sort of program.
Absolutely.
Is it more popular or less popular for people to even contemplate this? I'm kind of stuck with understanding how much education you have to do. I know you said they look on the screen and they do all this, but do a lot of people just come in and talk and then don't do it?
Well, interestingly, most people come in with some reservation.
Well, sure.
Generally, the first step is hearing about it from whatever source, whether it's the media or a friend who had it. They come to an educational lecture, and I give seminars a couple of times a month in San Diego and elsewhere that are 2 to 3 hour seminars that are very educational. So if they come in with reservations or don't quite understand, generally by the time they leave, they really have a good hold on what their situation is, what to expect, and the risks and complications of the surgery. So by that time, I think they feel more educated, so they feel like they're making a better decision, but the great majority of people, once they get the information and really understand what they're up against, go through with the surgery.
Now, do these folks who have allowed you to use their pictures and their stories, can they be used as ambassadors and or people that they can you can give them a name and they can actually call them and talk to Mary or Barbara?
Absolutely. I have many patients who really feel like this was such a life-changing event for them that they want to share it with other people. So when my website comes up in the next few weeks, I have a whole list of people on my website who are willing to be emailed and called if a potential patient just wants to talk to somebody who's really been through the process and who's walked the walk.
Well, because I think it's a little more believable in that it's not the doctor who's not pushing the program, certainly, because it is voluntary, but it's just getting a second opinion, but not from a medical source.
10 words from a patient is worth 1,000 words from me.
That's good. Okay, so from the day the surgery happens to the day that they feel like they're back to normal lifestyle, except smaller, is that a 30-day, 50-day, 2 months? When it's
Well, they bounce back or feel better at a couple of weeks. Most people go back to work at a couple of weeks. The long-term weight loss is generally within the first 10 to 12 months. They lose the majority of the weight that they're going to lose. But interestingly, in spite of the fact that their body has lost all the weight, it takes 2 to 3 years for a lot of people to really feel thin. Their brain doesn't catch up with what their body has done, and they don't recognize their own reflections when they see it in a picture window.
Well, we've run out of time, but some of the things I would have liked to have talked about, and maybe we'll bring you back and we'll do part 2 of this, is there's a lot of this is the psychology in addition to the medical side of it. They just generally feel better, and they're very proud of themselves. And I just watched the TV special the other day where a woman reporter dressed up in a fat suit and the kind of mistreatment she was given just in a city like New York. Well, I guess you could expect that in New York maybe, but this by the fact that she is what she was portraying to be. So there's a whole lot of other benefits, and I know that one of your own associates is overweight and probably will do this process too. But I want to thank you for A, picking to do this, I think 2, for doing it in San Diego, and 3, for being with us today to share the story, because I think it is a great thrill for you every time you see one of these success stories. Thanks all of you for watching, and stay tuned for next week when we have another equally important story for you to share with us. And thank you for being with us.
Thank you, Ted.